Hi, I'm Dr. Monica Wanacott. I'm a pediatrician, mom, and creator of pediatricanswers.com. Today we're going to discuss some common breastfeeding problems and how to help. Breastfeeding is natural, but it isn't always easy, and many women encounter problems. Let's discuss the common ones. Number 1, sore nipples. It's very common in the beginning for your nipples to be tender, especially at the beginning of a feed. However, the tenderness shouldn't last throughout the entire feed. If it does, this is probably a result of a poor latch, and you may need some assistance getting your infant to latch more appropriately. When your infant latches, you want to make sure that she is taking in a good portion of your areola. That is the pink part of your nipple. If you have very large nipples, that can be difficult as well. You're going to want to, when you talk about a large piece, you talk about the size of a silver dollar. Some of the products you can use that will help with this tenderness are lanolin cream, which can be applied directly to the nipple, and the infant can feed directly off of them, or something like some Soothies or hydrogels. Number 2, cracked or bleeding nipples. Again, this is usually a result of a poor latch. If, however, your nipples are shiny or exceedingly painful, it may be due to a condition called yeast. A little trick, if you look in your infant's mouth, you may see little white patches, which shows that they have thrush, also caused by yeast. If this is the case, you're definitely going to need to seek the advice of your physician so that you and your infant can get treated. Number 3, engorgement. Engorgement is more than just having your milk come in. Engorgement is when the milk does not properly drain from the breast. This will result in really rock-hard breasts that are uncomfortable and sometimes lumpy. The solution to engorgement is proper draining. So you're going to need to increase the frequency of the feed and the quality of the feed. Additionally, pumping can help relieve that pressure. You also can try some massage starting at the armpit and coming out, or applying some cool packs. Think of it like you would a swollen ankle. You wouldn't want to put heat, you would increase the flow and swelling. Definitely ice, no heat. Number 4, inverted, flat, or retracted nipples. Women who have any one of these conditions can still breastfeed. It's called breastfeeding, not nipple feeding. You can try a product like a nipple shield that can help have something for the infant to latch onto. Another option is to try the Hoffman technique. The Hoffman technique is where you take your finger, the nipple between your fingers, press in and rub together. Sometimes this will make the nipple stick out. You can also try pumping a few minutes before you start feeding your infant so the nipple sticks out. Number 5, plugged duct versus mastitis. In both conditions, you're going to have red, tender areas on the breast. In mastitis, you typically have associated fever and flu-like symptoms. Mastitis needs to be treated with an antibiotic, so you're going to need to seek care from your OBGYN. To treat a plugged duct, you're going to need to empty the affected area regularly. So increase the frequency of your feeds or try a pump. Additionally, you can try massaging the area from the armpit down or using a warm shower. You need to avoid the use of an underwire bra. Number 6, not enough milk. Breastfeeding is a supply and demand thing. If you don't feed frequently, your body will not make enough milk. Sometimes a woman has been sick or had to take a medication that decreases her milk supply. If this is the case, you can try to increase your supply by frequent feeding. Sometimes I recommend that a woman try power pumping. You'll try feeding your infant first and then pumping a short period of time later. This is essentially tricking your body into thinking that you're feeding twins and making twice as much milk. There are also herbs that you can try and medications. You should use these very judiciously, as a lot of them are not safe and approved in infants. Number 7, the sleepy baby. It's very common for moms to report that their infants fall asleep during feeding, especially at the very beginning. I recommend that you try to stimulate the baby. Rub their back, tickle their toes. Sometimes it will help if you stick your finger underneath their chin and stimulate their mouth. Additionally, you can pull back your breast slightly and it'll make them latch and grab. There are many more problems that you may encounter with breastfeeding, but these are the most common, and hopefully they help. I'm Dr. Monica Wanacott.